Hey guys, this is Daniel Rosehill bringing you this video today, not from my usual location, but from Tel Aviv. You can see the lovely skyscrapers of Tel Aviv in the background. I wanted to do a quick video about mental health because this is a topic that I think is so important. And I wanted to do one about taking stimulant medication for ADHD if you have high blood pressure. I just want to say at the outset, as I do in all these videos, this is not medical advice of any sort whatsoever. I'm just reporting on my personal experience as a patient with these things. So I figured that, like, if you take the amount of people with diagnosed ADHD and you take the amount of people with hypertension, there has to be a lot of people in that like cross segment, right? So but then when I was trying to find information about it online, it was really difficult. So I just want to talk about how I'm doing with that, and a couple of approaches that, having researched this a little bit, I know exist. One approach is to take ADHD drugs that are actually old blood pressure meds. There's two in this category, clonidine and guanfacine, but these are like third line ADHD drugs, and they are not approved for this indication in every healthcare system, including where I live in Israel. We don't actually have guanfacine. So if that is the case, you kind of have to work with your doctor. So I started blood pressure meds in last summer. I had like slightly high blood pressure my whole life, from way before I was even taking ADHD meds. I'm always like 140 over 90-ish, or a little bit higher. So I had to start blood pressure meds, which are fine. I just like take them every day. It's no problem. And so that I had to basically, okay, so the stimulants were off the table until I got my blood pressure back under control. And then when it was under control, so my doctor had me do a few readings after taking Vyvanse to see if the medication was like drastically upping my blood pressure. And it actually didn't have much of an effect. I was flabbergasted. Interestingly enough, I repeated the experiment after caffeine, and I found that it had a more significant effect on my blood pressure than Vyvanse. So blood pressure is a very unique thing, and everybody has different triggers for it. So I just wanted to offer hope because, okay, since starting Vyvanse again, life has improved drastically for me. I'm finding it a lot easier to get stuff done and get motivated and start. Task initiation is the thing I struggle with a lot. So that's been a lot easier. I'm just getting stuff off my to-do list much more effectively. I'm taking Vyvanse alongside Lexapro, and the combination is pretty common, and it seems to be working really well. I'm not getting those kind of downs after Vyvanse. I think possibly also because I am being a bit more responsible about taking it. I'm remembering to eat, which is very important. If you're prescribed stimulants, don't forget to eat. Even though your appetite might be gone, it's important to keep eating and keep drinking water, keep hydrated as well. And so far it's been a very positive experience. I don't know where I'm left now in terms of like, do I need to do the blood pressure Holter thing again periodically? I've no idea. But there's a lot to be said for if it ain't broke, don't fix it. So currently my blood pressure is good. I'm feeling a lot better now that I've started Vyvanse again. Minus my dry skin, which I'm looking at in the camera and is terrible. So maybe I need to go for, maybe I need to drink 3 liters of water instead of 2 liters. But yeah, stuff is pretty good. And I just need to work on sleep now because Vyvanse certainly is not a very sleep-friendly medication, and I'm finding it a little bit harder to get to sleep. I'm sleeping less than I did before taking it. Like, I'm sleeping maybe 6 hours per day, but it's really not the worst. 6 to 7, I would say. So I think that side effect will level out after a few weeks on the med. So that's my update from Tel Aviv today. It is just about sundown here, and no rocket sirens, which is always a plus. And I just wanted to do this video to fill the void of information on YouTube as well. I searched for high blood pressure ADHD and I didn't really get much info. So again, this is just my case, how it went for me. You need to speak with your doctor if you have ADHD and high blood pressure, but many people have to have these two comorbidities, and taking stimulants with hypertension that's well controlled evidently can be done because I'm doing it. I'm sure my doctor would not be prescribing the medication if it was unsafe. And that's enough. Signing out from Tel Aviv. Have a good day.